Welcome. I'm Dr. Jamie Wells, and I'm really excited to be here for our inaugural series. We're very lucky for our guest today, Dr. Conrado Sevilla. And this is our intro to the leadership at Genesis Medicus. We're going to talk about all things medicine. So thank you so much for our wonderful guest today to be here. He's board certified, and I use notes because I'm old school. So we all have to adapt to the different technology. He's board certified by the American Board of Psychiatry and Neurology. He is a physician specialist and lead psychiatrist at Olive View Medical Center, Department of Health Services, as well as assistant clinical professor, step 4 in the Department of Psychiatry and Behavioral Health Sciences at David Geffen School of Medicine at UCLA. He obtained his medical degree at De La Salle University College of Medicine in Manila, of the Philippines. He did postdoc training at the California Institute of Technology in the Department of Chemistry. His residency, internship, being chief resident, all occurred at the University of Vermont. I love the College of Medicine and Department of School of Medicine. I love the diversity of the landscape because medicine, as we know, is very regionally dependent. So it only helps with patient care to have influences from all over. He is medical director at Antelope Valley Hospital in the Department of Psychiatry, has been program director at UCLA Kern's Psychiatry Residency Program, been medical director at mental health urgent care centers, crisis stabilization units, and other crisis centers, been assistant professor at Loma Linda University School of Medicine. He's on many committees inclusive of UCLA Kern's Psychiatry, from topics that range from clinical competency and program evaluation committees to being on the board of governors at Kern Medical Center, the graduate medical education committees. He's given lectures, many presentations, been published, has won a number of awards for excellence in teaching, been Psychiatrist of the Year, as well as won leadership awards and preceptor appreciation. And from I've had quotes about you that include phenomenal academic educator. You serve as the clinical director of psychiatry programs for Genesis Medicus Clinical Campus, your leadership in didactics and curriculum development, as well as your work as a program director for the Genesis supported GME programs at MCH have been nothing short of transformative. So you are a very dynamic guest, and I welcome you so much, and thank you for taking the time to be here. Thank you, Dr. Sevilla.
Thank you, Dr. Wells. For someone who's been trying to fly under the radar.
Well, now it's the Dr. Sevilla hour, the Dr. Sevilla show. And you know, in all seriousness, it's so important. One of the things that I kind of have always realized, and I think is important for students to learn, that effective communication is as significant and meaningful to patient care for a number of reasons. That, you know, if you want to assuage suffering in patients, if you want to get resources allocated to the important research that you're doing, people need to know what you're doing. So as much as your want and desires to remain under the radar, when you're doing meaningful work as you are, that reverberates to the next generation, as well as improve quality of patient care, you're going to have to fight your personal desire a little bit to get in front. So in that vein, Genesis Medicus means really the birth or origin of being a doctor, physician, or healer. And so I'd love to kick off by learning about what your origin story in medicine is, and if you could show how that in your narration, which is way more, I think just showing, not telling, is a way better way for people, for it to resonate with people and for everyone to learn what your resume and life's work really means. So how did you get drawn into medicine and then ultimately into the realm of psychiatry? And if, for the benefit of students, you could address what that entails in terms of residency years and the like.
Well, to give credit, both my parents were educators. My mom taught preschool to ninth grade, and my dad taught accounting. And so I figured that it's in my genes, and I would follow their route by way of going into the field of psychology. And so academics was my primary choice, but since medicine came a close second, I decided to pursue both. And so I was going to go into bench research, but the opportunity to go to medical school uh, opened up, and so I attended the De La Salle School of Medicine while I was doing my graduate in master's in biochemistry. So afterwards, I still had the itch to do bench research, so I did my postdoc at Caltech under Leroy Hood, who's also a physician, but decided to go by way of being an academician. And so I worked with him for almost 4 years, doing research with AIDS and actually developing the systems and the technology to help with genome sequencing. So
Oh, that's
after,
how relevant is that today? You were ahead of your time too in that realm.
well, I had a small part. It's but after that, it would a baby came along, and I decided academics was not going to quite support that. So I went ahead and started my residency at the University of Vermont. And after that, it's just education, teaching took over, because ever since chief residency, I've been involved in hiring, been part of the program administration and teaching medical students, and actually mentoring the residents as well. And I continued to do that when I moved back to California, and at Arrowhead Regional, where I obtained clinical titles from both Loma Linda and Western University, both an MD school and a DO school, which, and then since I got recruited by my former boss and chair, Dr. Yu, to develop the first psychiatry program in California in 31 years, which is the UCLA current program, which has now been inception since 2003. So,
So
and
that's
then, yeah, and so, and so when I left that program, it was pretty stable. I had graduates who were basically sliding into their positions. And so I was recruited then by Dr. Kopelowitz to all of you to develop another program, which is the crisis stabilization unit, because emergency psychiatry has always been my interest. And from that, I was recruited by Dr. Marshak at Mission Community, where I started a second residency program in psychiatry to serve the underserved area of the San Fernando Valley area. And that's been since 2021, and I've been there ever since. And Genesis Medicus has partnered with DEANCO, who oversees Mission Community Hospital, and my relationship with Jack has started since then, and we've been fine-tuning the medical students that are rotating. It's
and with regard to
yes.
that, how do you feel the model of where do you put into the framework the model of precepting and its level of importance in medical training and uh, in terms of medical education in general's evolution into the future? How do you feel that helps or assists medical students? Or I don't want to put words in your mouth. Where do you feel that falls in the process, especially with simulations development and other kinds of?
Well, especially the third year core rotators, because for a lot of them, this is the first time they're actually seeing clinical psychiatry besides the didactics. And my goal is to promote advocacy and interest, and people that are like myself from the get-go. And if I can cultivate those individuals, and over the years, actually, I've been lucky, because some of the students have come back to do their sub-internships, and I've been lucky enough to match a few of them into the program. And they're now vested in the community. Upon completion, I expect to retain some of them actually to work in the community, to basically pay it forward kind of thing is what they want to do themselves. So in a way, for me, it's come full circle, because they pretty much embody what I was wanting to do having grown up in downtown Los Angeles.
So that must be, so you consider that the most rewarding part. This is a theme that I seem to be hearing, that it's not just educating the next generation, it's getting into communities and creating a legacy of, consistent pipelines so that these communities that haven't always been able to get served easily or readily are fulfilled, and the building of family kind of in multiple generations of training seem to be what a lot of preceptors find the rewarding process of it. Is that what drives you with regard to this kind of work?
Yes, just the satisfaction of watching these young physicians grow up and establish themselves in the community, and also at the same time helping the community with such a big gap in mental health needs,
Oh,
especially in LA.
definitely. Why in
and
LA
especially,
in particular, do you feel?
well, because I grew up in it and
Oh,
I experienced it, and also the homeless population. So in a way, this residency program that we have now has partnered with the LA Department of Mental Health. I actually now in my third year class have boots on the ground walking the
wonderful.
streets and street psychiatry. Their clinical rotation is part of the home team, which is comprised of teams that are actually on the streets of a service area, which is the San Fernando Valley, going to homeless encampments, going under bridges, and extending and trying to reach out to these folks that not only are psychiatrically compromised but also medically ill. So the emphasis on integrated medicine, because I think that's where the future is headed for psychiatry, is very big.
Can you speak to that a little more? What integrating with the medical field or the field itself of integrative medicine? Are you speaking of a distinction with that, or?
Well, in the past, there's always a stigma that psychiatrists are not up to par with medicine knowledge.
I never have thought that. Who thinks that?
But in a way, that was the public's perception. So that's one of the reasons why I'm also trying to eliminate that. And so I want the goal of the program is to produce very well-trained, comprehensive physicians that specialize in psychiatry. So when they're out in the field, not only can they do a quick medical assessment on top, because that is usually the priority before the psychiatric conditions are addressed, and we want to be able to address that. And so now what they do is that they refer patients to hospitals primarily for medical clearances, and then we're more stable, then we pursue the psychiatric symptoms.
Well, I think that's one of the resounding themes as well in all of that. I think it's important for students not to see that psychiatry is its own entity, family medicine, its own entity, surgery, its own entity. You have to be able to understand all of these to facilitate your patient's success, no matter what field you ultimately go into. Specifically with psychiatry, what is a path to that becoming board certified in psychiatry for students? What do they have to do, and what kind of fellowship, what length of these programs and fellowships do you have to do to become a psychiatrist?
Well, psychiatry residency is 4 years. In the past, it used to be a preliminary and an application, and then it will be a formal residency in psychiatry starting in the PGY 2 year. It's not been integrated, so anyone that applies to a categorical psychiatric residency program will start from the first year. But the first year is an emphasis, a part of it is also medicine and neurology, just because of the big overlap. And then after completion of the certification, as per the program, they become board eligible, and it's up to them to remain board eligible or be board certified. Board certification itself is a two-part process of written and oral examination, but it does board eligibility versus board certification for most folks. The compensation isn't really much different, but at the same time, if people want to go into academia, board certification is pretty much one of the criteria they would like to see. And also for now, board certification for a lot of facilities, because they expect people to, the physicians that are board certified, to maintain ongoing continuing medical education, so they stay current with the current trends.
And some of the types of fellowships in psychiatry?
Well, we have the ones that are actually in the most need is substance abuse, addictions, and child and adolescent. And so in Kern, because of the need in the Central Valley, that's what we started off with. After the program was stable, we started out with a child and adolescent program, which is now ongoing full, as well as a substance abuse or addictions fellowship, which I just looked into their website. They're fully staffed. So that's the plan. We want to do with this program as well in the future once we've reached the period of that all four classes are filled and stable.
So with regard to going back to the beginnings of even getting to the point of residency with psychiatry, what should medical students expect? What skills do they expect to acquire? Types of conditions they should see in the course of their core clerkship in psychiatry, what are good do's and don'ts or hacks in terms of getting high honors versus pass or fail? What kind of guidance can you give in terms of managing their expectations in the core clerkship of psychiatry?
Well, for starters, you can't beat medical knowledge. Everyone's a little different, but the ones that actually study more and come into, even if they've never been exposed to psychiatry as far as clinical, if they've read more than what they've expected, they have gone through maybe some volunteer experiences outside, makes a big difference. And it becomes clearly evident when we're observing them interacting with patients, and especially also when we're discussing case discussions, because they come up with, you can see that they are aware of the current trends, current medications, even the past medications, if they've read up on it. So I think self-starters and independent learners make a big difference.
Having proactive learning to bring up and delving into the cases that they see. What kind of are they exclusively, or do they have a hybrid of inpatient psychiatry, outpatient psychiatry that they see throughout their clerkship?
In our at least in our hospital, we actually expose them through because they're with us for 6 weeks. We break it up into 2-week blocks in inpatient psychiatry, consult liaison, where the medicine is important, and then emergency psychiatry and addictions. So they get a taste of a little bit of pretty much everything.
And is there certain baseline professional standard that are acceptable standards and certain things that deviate from that you would encourage them to avoid?
Well, the ones that are very gung ho, of course, there's some boundaries that need to be respected. They have to always be under the supervision of the resident or the attending, and if they are not sure, ask.
Right. Because I think people realize, I mean, being proactive, not reactive is so important, and you can balance both, but showing up on time, showing enthusiasm, all of these things are positive, and I think would be received well, especially in psychiatry. And actually, I wanted to ask you in particular with your background, because it is a very stressful time to be a medical student. What are some things that could help with stress management when students are feeling overwhelmed? They have boards, they have so many responsibilities. They're with rotations, sometimes not living where they normally live, or different things. You deal with personalities in a different way, depending upon level of maturation. You could be at different ages. What are some good strategies to deal with conflict resolution, stress management, any of these kinds of things from a psychiatric perspective would be interesting to hear.
Well, don't wait until it's become full blown. Let your senior resident or even walk into the clerkship director. I always have my door open for the residents and the students to come in for questions. As long as I'm not in a meeting or my door is closed, it's fair game. And my faculty and the others staff are also have the same understanding, and that if you're not sure, ask and let us know. Physician well-being is a big focus in residency training, but it's also important in medical student training. So the sooner they're aware of if their anxiety or if they have a fear of walking into a locked inpatient unit, we have 60 beds in our unit, and sometimes it's very loud. Let us know so we can make arrangements to tailor your experience.
And are there ways to foster resilience from your purview? It's always a balance. There are certain things, I mean, I don't know what you experienced. I started in neurosurgery before ultimately switching to pediatrics, and at the time was told I was the only female in the Northeast in neurosurgery. So I experienced a lot. And
Yes.
certain things that would not be tolerated today and the like. But at the same time, it's important to have a balance of, fostering resilience and dealing with different dynamics and complexities and things and balancing your work. So I think some of the greatest refrain is you're saying, if you sense something the earlier is, or are having challenges of managing your schoolwork and, getting to residencies and things, sooner you speak up about it, the better and more
Yes.
easily you can fix that issue. I know you've devoted a lot of time. I'd love to offer you a chance to give some final thoughts and offer one fun fact about you that has nothing to do with psychiatry. We've gotten shark diving to pilot to running to not really have a fun fact. So I'd love to hear your final thoughts and a fun fact that helps you cope with the stresses of
Well,
your.
well, I see psychiatry as a team effort. It's not a solo flight. And when I was growing up, my brother and I were big into car racing. So it's a team effort. Is as you're only as weak as your weakest link, and as long as the crankshaft doesn't break or anything, and you can also go as fast as you can, but within limits. And so it's
Right.
the same thing. Yeah.
And it's not a race. Everybody works differently and figures
Mhm.
out. And it also sounds like with your career, you pursued the thing you found the interest and passion in, and then these opportunities came and you followed your path. Because I know
Yes.
biochemistry was a means to an end for me. It wasn't a joy. So I bow to you that you physics and math loved. Biochemistry was okay, got to get through that one and stuff. But we all have our different things. Thank you so much for your time. This has really been
Dr. Wells.
wonderful. It's so nice to see such, I mean, for medical students, it's so exciting for them to get to this point and creating a nurturing environment where they can learn as best as they can and be successful is really what it's all about. And thank you for everything that you do for patients and for helping the next generation. And we're so grateful to see you today. Thank you.
Thank you, Dr. Wells. It was a pleasure.